Hi, my name's Linda Gray, and this is...
Mikey, Tal, and Gray.
And we came to Lakeview Hospital last year at this time when Mike was a near drowning victim. And it was a very close call for us. He had no heartbeat. He was not breathing. He was underwater for an unknown amount of time. It was during a big party. There were parents on the pool deck. We had a designated lifeguard. And what happened? Too much water inside of you.
My name is Greg Benton. I'm one of the emergency medicine physicians here at Lakeview Regional Medical Center. I remember the day Mikey Gray came into the ER very well. Kind of scary look to him when he got there, soaking wet, sitting in Mom's lap. Didn't look like he was doing too much breathing on his own, really not very responsive. So right when something like that comes in, especially kids, your heart goes out immediately and everybody just kind of kicks in high gears. He was stuck in trauma 1, started having a look at him. He really wasn't doing too much as far as just some minimal breathing on his own. He was also doing something else we call posturing, which sometimes is indicative of brain injury. But he was breathing on his own, and given a young body, you're never really sure exactly what the outcome's gonna be. Most of the attention in the ER went right there with Mikey, because there were a lot of things that needed to be done, some mundane, some not so mundane, but you know, you had to be looking at a whole bunch of different parameters, and every single nurse in there was on their toes and did an absolutely fantastic job and just came together as a very well-oiled machine, very well put together team. Decision was eventually made to intubate the child, which is put a breathing tube in to facilitate his breathing. His vital signs, aside from his heart rate being up, pretty much normal, but his breathing was a bit off, so we put him on a ventilator, did a whole bunch of lab work, x-rays, just really supporting his breathing, trying to maximize the amount of oxygen getting to his brain, because short term, that's about all you can do. And then you just try to stop any secondary injury, which you know is coming in a near drown, and especially the lungs just filling up with fluid. So it really becomes a game where you end up just kind of playing with the ventilator settings a bit, trying to just maximize oxygen, and he ended up getting what we call pulmonary edema, some fluid in the lungs, and we're trying to reverse that just with some of the ventilator settings. He ended up remaining mostly stable over the course. We got his oxygenation very good, and then I ended up hearing from his mom within another 4 or 5 days after that, and she said he was discharged home, and I think it was maybe 2 weeks or so after, she ended up bringing him by with a gift basket and a poster, which was very, very nice. I remember when they came in, the mother did have some vomit on her. Afterwards, I guess the nurses ended up trying to get her cleaned up a little bit, and also getting a clean pair of clothes, which is something you probably wouldn't think about too much, especially in an emotional situation, but little details that the nurses and staff end up looking toward, you know, just goes a lot toward patient care and showing the people that they care a lot, just going above and beyond the regular things that you would expect. All our ER doctors here, and not all ERs can say this, all our emergency medicine doctors were all board certified. And my nurses, I trust very, very much. This is a great place to work.